Okay, thanks everyone. We're going to get started. I'm going to introduce EJ Tom, who is the lead project director at Digital Infusion, and they have been with us since we totally revamped the Title V information system, and it's really been a pleasure to work with EJ. So he's going to take you guys through a demo or get you a little bit of a look at some of the enhancements that you're going to see. They're still working on the development of the enhancements, so he won't get to show you everything, but what he can, he will show you. So, ready?
All right, thank you, Nora. Good afternoon, everyone. It's a pleasure to be back again. I'm sure you all are excited to actually, this part of it, where you actually just get to see something versus actually reading slides. So what we're going to do is that you all have the slides in front of you, so I'm going to just actually refer to which slide I'm actually on just to orient you on where we're at, and then we'll just go through there. And as Nora mentioned, there are some things that I can't show you at this point that we'll actually go over the slides specifically on there. With the new guidance and all the changes in there, that's what I'm going to show you a lot of on how you go about selecting national performance measures, what you're actually going to see in terms of the system once you select it, what do you need to do. So we'll go ahead and get started. So on slide 55 is where you can see a layout of what I'm going to talk about today. But then on slide 56 is where we're actually going to start off with the NPM selection process, which is the very first piece, which I'm sure a lot of you are interested in, on what you would go about doing once you select. A couple of key things to note on here is that we have had questions too that there may be some states that aren't changing any of their national performance measures at all, but you would still need to go into the system and do the process that I show you to go about selecting. So I'm just going to, pardon if there's any New York people in here, that I'm just going to use your state to show. So here, I'm sure you all are very familiar with the TVIS main menu and what you would see going through the electronic handbooks, which is HRSA's grants management system. So as you see in the slide here, it's recommended that you do this part first. You can see that you have access to everything else, that you can do the financials, the narrative, among other things. But the reason why we suggest that is that a lot of the forms and sections depend on your national performance measure selection, so it's ideal if you do it first. Because as an example, that if I haven't selected any national performance measures yet, you're going to see that there are no ESMs in here as an example. Same thing for your state action plan table when you go in there where there's dependencies there. So that's where we were advised to do that. For going about selecting national performance measures, you would go to the Form 10A National Performance Measure, NPM form. As you can see here, since there are no national performance measures selected, just like you're accustomed to, we have all the validations of the system that here is letting you know that you have not selected any of your 5 yet. So we have a Manage NPMs button here that you would click on. When you click on the Manage NPMs button, it'll take you to the Manage NPMs page, where here you're going to have a table that's going to list all the national performance measures, all 15, and trying to make it easier on you that we have a column here that easily identifies which national performance measures you selected previously. Now again, as you've heard from Michelle and Chris as part of their presentations, is that this is up to you on what you go about selecting. There's nothing in the system that's going to force you saying, well, you did NPM 1 before, you have to select it again. No, you don't. If you didn't select it before, there's nothing going to stop you from selecting it as well. So you could go as high as 11, 15, or however many you want. But the minimum is 5, as you can see here. So how you would go about doing that is that here I'm just going to go ahead and select NPM 1 because I've selected that before. You would click on the Manage button. And then here on a couple of these slides, on slide 59 is where it talks about ESM carryover and reassigning. So what I mean by that is carryover is going to apply for those national performance measures that didn't actually have a number change. So you may have seen in the guidance you saw like NPM 7 is now 7.1 and 7.2, your NPM 13 is 13.1 and 13.2. So for those that had a numbering change, you're actually going to have to reassign your previous ESMs to those respective .1 or .2 parts of those measures. So since NPM 1 didn't actually have a numbering change, it's going to carry over all the ESMs that you had before, whether they're active or inactive. So you can see here that it lists for me all the ESMs that I had, in this case under NPM 1, and all I need to do is click on Select Measure. And and I'm on wireless right now. Okay, so you'll see you get a message indicating that NPM 1 is selected successfully. So that just gives you an overview of what you did. So you would need to do this for each of the national performance measures that you want to select. So you have to keep going back to the manage page, looking it over, and then selecting the measures one at a time. So I'm just also going to show you that there is still a validation, as we've talked about, that you need to have 1 NPM per population domain. So I'm just going to select these really quickly just to show you that. You're not going to see that message until you select at least 5 NPMs in there. So I'm just going to select randomly 5 of them just so I can show you that error message. So you can see NPM 4 I did not select before, so there's no ESMs displayed underneath here, as shown right here. And then I'll select NPM 5 because we're going to talk about that a little bit later. You can see that's one I selected before with my ESMs. And one thing I want to note on this as well is that, even though we recommend doing all of your NPM selections, you'll see here that there's nothing actually preventing me from going anywhere else, so that maybe I could select 3 of them and maybe I want to finish later, that you can come back. You don't have to do all of your 5 all at once. And I'm just going to do NPM 10 here. And then I'm going to show you NPM 13 because that's what I wanted to mention to you about reassigning, on how that concept works. So you can see here that on these .1s and .2s that there are actually 2 separate manage buttons that you need to do, because you can select them. You don't have to select both. So if you're doing NPM 13, there's nothing saying you have to do .1 and .2. Same thing for NPM 7, among the others. So here it says I selected NPM 13 before, that I'll go ahead and select it because 13.1 is under women maternal health. So I want to do that. And then here's what I wanted to show you. Now forgive the resolution here because it's really compact because of the projector. But what you'll see here is that under NPM 13, it's going to show you all of the ESMs that you created under there, because as you all know, you selected as 1 measure before, and it was under the cross-cutting life course. So this part of it is where, okay, if I'm under 13.1, which is under women maternal health, just as an example here, I can kind of just read these and realize, oh, this one's related to pregnant women, that it conceivably should be applicable to 13.1. So since I'm under NPM 13.1, if I want to keep this one and continue reporting, all I do is click on the select here, and that'll automatically assign this ESM to NPM 13.1. Okay. And then let's say I wanted to bring over also the other part of the measure, which is related to more, child and adolescent. So then I would just go down here to the 13.2, which you can see I can assign it to child and adolescent. I just click manage. And you can see that now I have the option to select whatever domains I want it to be under. I just click it like that and click select measure. So now you can see that, again, I still see my ESMs. I can't do this one anymore because I've already assigned it to NPM 13.1. This allows me that maybe if I wanted to, I could switch it to 13.2 if I wanted, but most likely you're not going to need to do that. So here, since this is the one related to child and adolescent, just looking at these titles here, I can say, well, okay, it looks like 13.2 ESM would go to NPM 13.2. So I'll go ahead and select that. Okay. So now that I've done that, the other thing too that I want to mention on this page is that even though these ESMs are listed in here for you to assign, you're not obligated to assign every single one of them. So as you can see here, I could choose not to bring over this ESM 13.1 and I could not assign it to anything, and you don't have to report on it. So since I have 5 NPMs selected, you see I have the message here that is saying that each population domain needs to have at least a unique NPM assigned. So this is why we set up this interface in this way, that you can look on this right column and see, okay, I've selected these measures over here. Do I have an NPM for each? And right away, I can actually see, well, I don't have one for the CSHCN one. Okay, so that's why you get that message. So you can just use this table as your reference to do that. So on that note about ESM assigning, for those ones that are split apart on what I just showed you for the 13.1 and the 13.2, where I assign them to individual ones, we had to do a different numbering convention for those. So I'll show you what that looks like. So if I go to the ESMs, where I would do my data entry, So you'll see here, as I talked about, that NPMs that didn't have a numbering change, as we talked about the NPM1, it carried over all of the ESMs that I had, regardless if they were active or inactive, and you can see the status here, okay? Whereas if I scroll down to my NPM 13, you can see here that now we had to do a different numbering convention so you can easily identify where you assigned it to either the .1 or the .2 of that. So you can see the one I assigned is 13.1.1, and then you have the 13.2.1. You can still add your own ESMs. You would do that as you have done before from the 10C, Form 10C, where you can see here we also have the message that you need to have at least one ESM per NPM that you've selected. So right here it gives you a clue right away, NPM 4 doesn't have an ESM assigned. So let's say if I just wanted to add a new one in here. So you would have to complete a detail sheet as you've done before. So I'm just going to do test ESM for NPM 13.1. Okay, so I'm just going to do another one for 13.1. So you just select which one you want to assign it to. And you type in, I'm just going to type in random information in here to complete it. So you'll see that once I've added that in, TVIS will automatically renumber it for you. So you can see that since I've added my new one here, it's now 13.1.2. Okay. All right, so moving on to slide 64. We're going to talk about what you actually see on the data entry pages when you go into the respective national performance measures. So to do data entry for national performance measures, like you've done before, you would go to the Form 10A NPMs. And what you would do is that you would click on the measure title to go into the data entry form. So as noted in this slide here, I'm going to show you the example of what you would see for a national performance measure that you selected before and chose to carry it over. So as you recall from our example, NPM1 was selected previously, so I'm going to click on that. So now on the national performance measure 1 that we selected before, you'll see that we populate the FAD, the federally available data, and now it's going to start becoming a multi-year table, as you can see. So last year you saw for the first time the 2016 that was populated with the FAD available. Now we're adding a 2017 column that's going to populate the most recent FAD this year at this point in time. Okay. So don't look at this data, this is just test data in here, but just to let you know what's going to happen. Also, there's going to be a state-provided data table where if FAD is available, this will be optional to you, as you can see, that you can choose to provide data if you wish. Or if there is no FAD available, then this becomes required of you to do, okay? And again, it's just like the FAD table, it's going to be a multi-year table too. And then for measures that you're carrying over, you're still going to have your annual objectives that they're going to go from 18 to 23. Now to show you a measure on what would it look like if you did not select it before, and that's the reason why I selected that NPM4, just to show you what that would look like. Since in this case, New York did not select that before, so I selected this one. So for NPM4, which I've never selected before and I chose it this year, you'll see that there is no multi-year table in here. It's going to start with the 2017, since that's our reporting year. It's going to populate the FAD, if there is any. 17 for the state-provided data. And then the annual objectives are going to be from 19 to 23. Okay. Okay. So now on slide 65, I want to talk about what you would see for state performance measures. So how you would go to the state performance measures data entry pages is you would go to the Form 10A SPMs. So you can see here that the system's going to already pre-populate whatever state performance measures you had. And you'll see here that you have your active ones. You would click on the measure title to go into the state performance measure data entry form. So I'll go into the SPM1 here. And I'll talk about this next in the next couple of slides. But you can see that just like what I showed you for the national performance measures, it's going to become a multi-year table that's going to collect data over time, 16 and 17. Objectives, same thing, 18 to 23. Now, if you create a new state performance measure this upcoming year, I'll show you right here. This is just a sample one that I created in here. That if you create an SPM this year, all you're going to have is objectives in here. You're not reporting any data. Okay, so all you're going to have is 19 to 23. Okay. So on slide 66, I'm going to talk about the NPM5, which Chris talked about as well. That for NPM5, it had to have some data entry changes in there now that it's been broken up into 3 parts, A, B, and C. So as we can see here, since I've selected it, we'll go into the data entry form just to show you what it looks like. So just a reminder is that the 5A is actually the NPM5 that you all chose if your state happened to choose it. So it's going to grab any federally available data and any state-provided data that you may have entered in if you selected NPM5 before. So you would have that, and as you can see in an example here, it's going to carry over any notes you may have had and any data that you may have entered into there that you can update it or you can just leave it alone. So it would look like this. Now that we've added in the NPM5 and the 5B and 5C in here, that you can see that now there's corresponding state-provided data tables, annual objectives, and since these did not exist before, it's going to be like that model that we just talked about, that it's going to be annual objectives 19 to 23. As you can see here, that you'd have the same thing for 5B and 5C. So since for state measures, these state-provided data tables are required of you to provide data, we understand that this is new this year, that if you chose to continue reporting on NPM5, the recommendation is you probably do your best guess at baseline estimates to put into this table for your indicators, numerators, and denominators. You're not going to obviously have an objective in here because these didn't exist last year. Another thing that is proposed too is that MCHP does understand that since this is the first time that normally we don't like saying put in 0, but you could technically do this. And whatever your data source is, you can put in your year, and then you can do provisional or final. That's another way, but the key if you do that is you have to put in a note. The system's not going to force you to do that, but to put in the note. So since I'm the contractor, I'm going to make sure that Michelle and Chris say yes to this, that they all aren't going to say, oh, well, EJ told me to do that. But that's another way that you could go about doing this one, that probably better if you have baseline data to put in versus a 0, but I wanted to put that option out for you. Okay. So let's go to slide 70. Or I'm sorry, 69. So slide 69 is talking about the NPM 11 and NPM 12 that Chris and Ellen talked about. These are those CSHCN measures. So for these CSHCN measures, I have to actually select it since I didn't select it yet. So I'm going to go back to my Manage NPM page. And just for showing you, okay, well, New York selected NPM 12 before, so I'm going to go ahead and select that again. So you'll notice here that on this select page, if I select NPM 12 or any of these 11 and 12 that are CSHCN measures by default, you'll see here that the system automatically assigns that, so you have to report on it. But you do have the option also of selecting the additional domain. So all I would do is I can click on that I want to assign adolescent health to it. It's going to carry over all of my ESMs. I select measure. Okay, so it's been selected successfully. So now if I go back to where the data entry is, so if we go into NPM 12 here, so as mentioned in slide 69 is that since I selected before, I'm going to have my multi-year. Now, one thing that I'm noting while we're looking at this, and this was kind of talking about the NSCH that was talked about earlier during the data section, is that since the old survey and the new survey is now comparable, you'll notice in here that we are not displaying for you what was populated last year with the old survey data. So that's why you see here that last year for any of the NPMs that you had NSCH data, we originally populated the old survey in this 2016. So we have, of course, a disclaimer letting you know that as well, that because they are not comparable, we're not displaying it next to each other. And in the 17, we will display the new NSCH survey data in here if it's available for your state. So also for NPM 11 and NPM 12, that What you reported previously was specifically focused on children with special health care needs. But as you saw in the example, I selected adolescent health, meaning that you're indicating you wanted to report on the non-CSHCN population. So added to this form is that now that I selected, in this case, adolescent, as you saw me do, is that now we're going to have a non-CSHCN FAD if it's available, because you know we had those data sets before. And then also you'd be expected to report state-provided data and annual objectives for that. And it's classified as non-CSHCN, and you can see my adolescent health here. Okay, so that's going to be for NPM 11 and NPM 12. Okay. So now on slide 70, we'll talk about a few things on state performance measures. So going back to what we were looking at before, is that you may have state performance measures that were assigned to the old cross-cutting domain. Obviously, they cannot remain assigned to that. So what the system is going to do is that if your state has any state performance measures that were under the cross-cutting life course, the system is going to have a blank cell here, as you can see. Okay? And it's going to tell you that whatever SPM it is, that it needs to have a population domain assigned. So in this case, my SPM 5 here was under cross-cutting life course, the old one, that we need to go into the detail sheet by clicking the edit link here. And you'll see that now from this view, we have the ability to now assign it to a respective population domain. So being a state performance measure, we can either assign it to the new cross-cutting systems building one, or we can assign it to any of the previous other 5. But you can't do a combination of both at the same time. So you'll see what I mean here, that if I click this one, these all gray out, and I can't assign it to any of the other ones here. So I could do either or. Okay. So that's what you need to do if, when you go into TVIS, that you see any state performance measures that have a blank in there, it's because it needs to assign to a new domain. So now you can see my SPM 5, now I have new domains assigned to that, and that error message I had up here is now gone. Also, what was mentioned as well is that there is no minimum or maximum on the state performance measures before. Originally, you had to have at least 3 and no more than 5. That's now gone. So you can see here a perfect example. I added my new one, and now I have 6. Okay. All right, so now, we did some changes to the inactivating of state performance measures, state outcome measures, and evidence-based strategy measures. So the reason why we made some changes to that is that for those of you that inactivated some, you may have noticed that it required you to provide future objectives, and then you had to go between 2 forms, and it was a little bit cumbersome to do that. So how we've gone about changing that to make it a little bit easier for you is that you would go to the data entry form for any of the state performance measures or even ESMs that you want to inactivate. And you'll see that we've added a button in here now. Before, you had to go to the detail sheet and activate it. So now by adding it here, because it's going to force you to provide data, why not have you on the data entry form while you're doing that? So if I choose to inactivate the measure, I would just click on this button here. And you can see, like you saw before, you're going to have the different reasons, whether it be completed, replaced, or if you do other, you can type a custom reason if you want. So I'll just do completed. So then once I select it as inactive, and if I try to move on, it's going to let me know that I have to put in all this information in here. But the other thing that I wanted to point out is that you see here how we had all these annual objectives on here? Before, you actually had to put in a future objective, which didn't make logical sense, because if you're inactivated, why are you putting future year objectives in there? So you'll notice that if I see this table here and I click on this button, that table is no longer there anymore. Okay. So once you designate that status, the future year objective table goes away, that you're no longer required to report any future year objectives on that, which obviously makes sense. So then you would just be required to put in data, complete all these required fields. This. Oops. Where else did I, oh, my reason. Okay. So once you do that, you'll notice it's inactive. I can no longer click on it anymore. But you'll also notice this over here. So we heard from some of you that when you were inactivating, you accidentally inactivated them. So So we developed something in there that now you can reactivate it if you choose. Because I did get a couple calls from some of you on that. So it's as simple as it is. You see, and this is only for ones that you've inactivated this year. Okay, so you could click on this reactivate that says, are you sure you want to do this? Okay, I want to. So once you do that, you'll notice now it's back to where it was. You can click on it again. Maybe you realize, oh, I should have inactivated that. You click on it again. Okay, you're going to have to do this again. Click the reason why, or maybe your other reason, oh, we didn't explain that right or something. You know, whatever it may be. But at least now you have the flexibility that you're not bound, as we told you last year. Once you inactivate it, well, that's it. You can't do anything else. Okay. 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 On slide 75, I want to talk about something new that was added to the ESMs. You may have seen this in the guidance, for those of you that looked at that there is a concept of ESM subgroups in there. So I'm going to go back to my ESMs. And this only applies to certain ESMs, as you see in the slide here, that not every single ESM, depending on which national performance measure it is assigned to, that you would have an ESM subgroup option. So you can see that on the slide. I'm not going to go over every single one of those, but one of them that we selected was the 13. So I'm going to go to my NPM 13 ESMs, and where you would assign ESM subgroups is from the detail sheet. So I'm going to go into the detail sheet, and you can see we've added a section here called ESM subgroups. So for each national performance measure, you have different options available to you. So depending on which national performance measure it's assigned to, you're going to have different subgroups to assign to. It's a multi-select that you can do any number of them, and then it'll just display. Okay. Now, one thing to note is that ESM subgroups is currently optional to the system, so you don't have to do this, but you could easily go back to any of them that you created before and do this subgroup assignment in there. It just gives another way that if we're running ad hoc reports for MCHP, that it could be further queried based on these subgroups. So state action plan table changes. This is something that we're still working on, so I can't actually show that to you right now. But let's see if I can actually get the front page. Okay. So right now it's not fully done yet, but as it was mentioned before, is that this year that all 59 states and jurisdictions have to use the MCHP format, meaning they would have to use this layout. For those of you that have used the format, this should look familiar to you in terms of this interface, where it's broken down by all the domains. You would have to add in what we're referring to as entries, which would be sort of the rows in the table by each population domain. Since there were a lot of changes, as you all have heard, about the performance measure framework, it was a challenge that we couldn't just dump whatever you had in there before, because there would be mismatches and there's no way that we would know that the table is in fact what you intended it to be. So because of that when you go into your state action plan table, even if you used it before, it's going to be blank like this, okay? Meaning you would have to add your entries back in there. But one thing to help alleviate some of that, we know that's going to be a pain, is that you have this add button here where you had to create them from scratch. So we're going to add in what we're kind of referring to as sort of a copy feature, which is sort of a little bit more robust add that you could sort of click on that copy button. It's going to show you all of the entries that you had in the past. You could select from them, and then you choose, okay, I want to do this one, I copy it, and then it's going to at least pull over the objectives and strategies that you had there, because I know that that was a major issue where you had so many objectives that you had to do one at a time, so hopefully that should save you some time. So that way you could do that across different domains, that you could choose to copy one from adolescent health and put it in child health, et cetera. I know that probably a lot of you are going to have those cross-cutting life course ones that you're probably going to want to now move into women maternal health or wherever you had those NPMs that were the cross-cutting, like NPM 13, 14, and 15 that were under there. So that's just a quick snippet of that, of what we're changing on the state action plan table. But as we have more trainings and it's actually developed, that we'll have more in-depth to show you how that works. As for the narrative changes, I can at least show you how we've sort of adapted the narrative main menu, because you've heard how it's been rearranged based on the new guidance. is that you can see here, we still have the same interface before. It's still Word upload for you. That'll save you some time. But you can see how we've started to reorder it now that, you have this new executive summary that Michelle was mentioning to you that's now broken up into 3 sections. So you have your program overview, which was the original one, the 15,000 characters that you upload. And then now those subsequent sections are added in there for, the how Title V funds are being used, and then the MCH success story, which you can see that those are about 1,500 characters. That's probably about a paragraph. So, and you can see here we've moved the financial narrative up here and renamed it as such. Okay. Yes, yes. So the other thing too is that in your folders you have this document here. So I'll talk to that, and I'm showing it on the screen here. So I just wanted to walk you through this document. It's a very handy document that lays out all the sections as I showed you on that in TVIS and how it lays out. It even gives you the character limits, which ones are Word upload sections. It tells you which ones are new sections. It tells you which ones are shared character limit sections. So there are a couple that you can see here that have shared character limits. Also, I wanted to point out that when we're talking about your discussion on the state action plan table or state action plan regarding your domain breakdowns, where you did the annual report and application year, the cross-cutting systems building one is an optional section in the system. So you're not going to be required to upload anything to those 2 sections for that domain area. You'll also notice that we have a new section 6 on the other side of the page, which is your organizational chart. So that's something that you did not have in the past, where you upload a PDF document of your organizational chart. We know in the past some states did a combination of things of either embedding it within their overview of the state, or sometimes they put it in the supporting documents, but now there's a specific section for the organizational chart. Also on the bottom here is just identifying the sections that were removed. So that way you could know, and there's some guidance for you telling you, okay, where do you now talk about it now that these sections are not specifically called out like they were last year. Okay. And this is also another good document that on the far right column here, it tells you where some sections were what they were before. So at least you can kind of link it up, like as an example, your MCH workforce development was section 2F.2 last year. So that also helps you too to know where things are. The other thing I wanted to point out too is that on slide 80, as was mentioned earlier, is that I know I went through a lot of this fast. It's on the main points that were talked about today, but there are obviously other areas that maybe you might have questions about. We're actually going to have learning labs at AMCHP, as you can see on slide 80. Let me see if I can pull that up. So on slide 80 here, we're going to have sessions tomorrow and Monday. So you can see the times. There are some sign-ups on the back if you wanted to sign up for a one-on-one session. As you see here from the 10 to 10:30, it's basically going to be another reiteration of what I went over, so that if anyone that couldn't attend this, they could attend those sessions. From 2 to 2:30, we're going to go over a little bit when you're uploading Word documents, how you go about making them more ADA compliant for individuals with disabilities to read the content. So that's pretty much the layout of how we're going to be doing those learning labs tomorrow and Monday. So facilitating that will be myself, Nora, and then Elisa Pete, who I know a lot of you have worked with for in-use support, will also be there, that we can answer any questions you have, that you want to discuss. Just going over resources here, Elisa Pete, myself, HRSA call center more so for any EHB specific things. And then of course you always have programmatic assistance as you had in the past, where you have the state MCH BG at HRSA.gov, and then of course your project officer. So any questions?
Use your microphone.
EJ, while we're waiting for the microphone, could you just share, you talked about the character counts, but can you tell the audience what we've changed in the state action plan relative to the character counts. And you highlighted the shared section, but I think we need to really make it clear that we've heard from you all about you had too many characters in one section and maybe not enough in another. So how we've tried to really give you a little more flexibility there.
Yes, thank you, Michelle. That's a good point. So last year, some of you were accustomed to the shared character limits that we had, in particular to the domain sections, where you had to do your annual report and application year, where we had, as an example, under women maternal health, we had 70,000 for those two, and then you had 70,000 for the other. That what we've done to change that is allow a little bit more flexibility, that for these sections where you have shared, is that you're not going to be bound to do 70,000 for each of the domains. This 450,000 character limit is across all of these domains. So you may even have like 15,000 under, cross-cutting, and then you have 80,000 under another. So that's just a change that we've also done that Michelle was alluding to, that it's allowing you a little bit more flexibility, that you're not bound by domain. The same concept is also applied on our other shared section that you see in here, where we're talking about the state action plan overview that was also talked about on explaining overall about your project, is that for these sections, program purpose and design, and then all these on workforce development, family partnership, this is where all these sections are shared across 36,000, that you're not bound to each of those by a specific amount. You can use the 36 across all of them.
Okay, here's my question. New this year is, what are you expecting for state systems development initiative? What is the expectation? Are we supposed to be referencing like what we're doing with our SSDI plan?
Let me repeat the question, because I know this session is being recorded and they want you all to use the microphone if you can. So the question is really, and good observation, Ann, we've added a section on SSDI, the State Systems Development Initiative. And think back to SSDI, what is the purpose? It complements the block grant. It's to enable you to enhance your MCH data capacity to be able to report in the block grant and meet the reporting requirements. It's never, we've had a separate application for SSDI, and you do a separate progress report. We wanted to bring that in together because they are intended to be complementary programs. So we would like for you in that section to really talk about how SSDI is integrated really in supporting your Title V MCH block grant program. And it's described in the application annual report guidance. And certainly if you have questions, we're happy to answer those. But because so much of SSDI really, the benefit, the outcome of SSDI is reflected in the block grant application, we thought we needed to bring it in and make that association.
Okay, over here first.
Hi, I have 3 questions, but they're pretty quick. When does the TVIS open for us to be able to do data entry?
So right now, the open date would be April 2nd.
Okay. And is the character limit, can you remind me, I can't remember from last year, is that with spaces or without spaces?
With spaces.
With spaces. Okay, and then my last question is around explaining our justification for dropping some of our NPMs. Is that something that we would include in our data entry on TVIS? Or is that something that we would include in our narrative section? And if so, where would we include that? Because I'm seeing that the linkage of state priorities and national performance measures is being eliminated, and that's probably where I would have put that.
If they drop NPMs, and where should they make that discussion of why they're no longer?
That's a very good question, and it's something we actually struggled with. And we all had the memories of the first 2 years under the previous guidance of reporting on the old measures and then talking about the new measures. So we decided for this purpose, we weren't going to require you to report on the previously selected NPMs, even though we recognize You're reporting on, a fiscal year where you had those, fiscal year 2017. But what we do ask is that you talk about it in your narrative discussion and talk about, we'd like to know why you dropped them. And, give us your line of thinking there, and do discuss the progress you've made, or, why you feel this is no longer an important measure for your state. You feel like you've made progress, or you feel like it's really being addressed through a different measure. But we do want you to bring that discussion into the narrative. Well, Chris?
In the domains.
I think, again, this is your story. So I always think states can make the best choice where they want to put it. I think if it were me, it's probably going to be in the domain section. But, it could be in that front introductory section where you really talked about you're moving it sort of in a new direction, or you've restructured, or, so you may want to bring it into that kind of overarching discussion, and then further develop it or document it in the individual domain section.
Okay, right here.
Okay, thank you so much for providing additional sections in the executive summary section. I'm sorry, maybe I should stand up. You're like trying to look over heads. Hi. Thank you for providing additional guidance for us in terms of really being able to elaborate on our executive summary. With respect to the section about how the Title V dollars supported state MCH efforts, how is that different than our financial summary that we're going to be submitting, or are they similar?
They could be similar. Keep in mind, an executive summary is a standalone piece. So you may want to really bring some of that discussion in there, but then it's a little bit more detailed discussion in your financial narrative justification.
Could you clarify for NPM 5 a little bit? Are we going to be required to report both data and narratively on parts B and C if we had previously selected NPM 5?
Oh, goodness, sorry. 8 inches. 8 inches. I was right on top. So, yes. With the data coming in, as EJ noted, that this year we always have an issue when we bring in new data or start something up as to how do you get it going. This is where he was talking about putting a note, putting the data in, but it's trying to look at baseline data, put that in for B and C. We know that this is a question that is developed in PRAMs that's going to be coming out in the future, but right now it's asking you to put in this year to kind of kick it off with baseline data that you would have around that. Feel free to work with Ashley Harai, and also work with you can certainly work with me and EJ to help address and look at those questions and how you do that. The key here, I think, is if you don't have data to provide, it's key to have that note in. Especially if you use that 0 as an indicator to kind of kick off the process as we start to collect data on this form.
I just noticed that there is objective till 2023. And will the national performance measure continue through the process, or will new measures will come after the next cycle of the needs assessment?
Devaya, that's a great question. It really is a great question. I think what we run into right now is the cycle between OMB approval and the needs assessment cycle, that 3 and 5 years that Michelle talked about. The current guidance goes through the needs assessment. In other words, we will not be able to change any of the national performance measures until after that needs assessment cycle is completed. So the selection in the 3rd year of this guidance will be relooking at
Newer ones.
The current 15 NPMs going into 2020. Okay. In other words, we cannot just, now the conversations may happen about, are these representative, are there ones that are better? But that would have to take place by the new guidance. Again, we're running into the challenge of the OMB cycle and the needs assessment cycle.
Thank you. Thank you.
All
I just had a quick question about the sessions that you were talking about, EJ, addressing making our block grant ADA compliant. If there are folks in our states who are not here this week, is that going to be available to them in a distance learning format somehow?
Yes, like we're going to actually have a formal, PowerPoint on it. It's going to be more so a 15-minute of guidelines of things that you need to look out for. One thing that we were thinking is anyone that comes actually to the session, that you can tell us, your email address, we can email it to whomever, that you at least have the electronic copy, and that it could be something that if there's, you wanted a more guided versus just looking through the PowerPoint itself, we could always set something up to do that.
It could also be a topic on one of our learning labs.
Because we will still have those after the April 2nd as well.
Thank you, EJ. This has been very helpful. One question for the previous NPMs that were in the life course domain that are now in 2 separate domains, for example, the oral health, will it be required, I'm assuming, that each one minimally have a related ESM?
Yes, if it's broken up like that.
Okay.
So the concept of the ones that are broken down to .1 or .2, like the NPM 13, as I showed you, you have to have an ESM to each part. NPM 15, as an example, since that's not broken up into separate parts, you need to just have one ESM, even if you may have selected under multiple domains.
Okay, so that would apply also for the Safe Sleep.
Exactly, yes.
Okay, thank you.
Modify ESM. Modify.
It'll still stay with the same number, yes. All right, well, thank you, everyone. Next up will be Michelle to talk about a little bit about Form 5 and Form 11. Thank you.
Oh, mercy. We're at the end of the day, and we're talking about Form 5, the infamous Form 5. And once again,
Sorry.
oh, wait a minute. You've got me unplugged or something. Thank you. And as you can see from the slide, we have Dr. Ashley Harai, who's supposed to be presenting this. So, I won't even begin to be like Chris. Obviously, I'm not Ashley. And it was kind of comical for those of you who know Ashley. She's a senior epidemiologist, terrifically bright and knows this stuff. And so she sent me a few talking points last night. And I'm like, huh? I kind of thought I understood it till I saw these talking points. We're not going to go there. We're just going to. But I'm going to put a plug in because Monday night we are having a Form 5 discussion. And that's, Ellen, help me, 5:30 to 6:30. So everything you really need to know about Form 5, come to that session. But we'll hit a few high spots here. As you know, this has just been a pet project for 3 years. It's a work in progress. I think we've really made some progress. So, before the release of the last guidance, states weren't really talking about how to report participation. We had one form. And, states came up with these numbers. But when you went across states and how they were doing it was so totally different. And the real issue was that, states were moving to population-based services. And yet a lot of states were using clinic data, reporting direct services only. Numbers were going down or they were erratic. And we weren't really capturing what we do in Title V. So because of that, Ashley and I embarked on a journey, and I've got some slides to show this, but we formed a work group, and the questions, I am so pleased in a way, because the questions we're getting now are good questions, and they're the right questions. And I won't say we've had the answers. This really has been a partnership in thinking together, all of us. And I think we're further along. Are we there completely? Probably not. But I do think we have better numbers and we're better capturing what we need to be reporting than we were 3 years ago. So thank you all for that. Thank you for bearing with us. Thank you for joining arms with us and really trying to work together to solve this. If you think back to what I first said, we don't just sit around and think of requirements for you all. They're based on the legislation, and the Title V legislation requires each state in its annual report to report the number of individuals served by the state under Title V, by class of individual, and the proportion of each class of such individuals that has health coverage. So in addition, this, we have, in 1993, the Government Performance Results Act was passed, GPRA, which for the first time linked budget and performance. And our GPRA measure, among others, has been number of children served by Title V, number of children served by Title V who are enrolled in Medicaid and CHIP. And/or CHIP. So these are numbers that are tracked, and if you've ever gone to the Department of Health and Human Services congressional budget justification, you're going to see reporting on those two measures. So they're important. They're important for you all, but they're important for us as well. But, what's the question we really get, and I think the question people really want an answer to, is what percent of the population are you serving in Title V? So we've tried to sort of move in that direction, and this, again, gets into some of the history and why we were concerned, because the numbers they were, in some states were reporting. We instructed states to report across the top 3 levels of the old pyramid, where you had 4 levels. And some states were doing that, some were reporting across the top level. So there was no consistency across states. And the numbers, these are important numbers, and yet even we were kind of questioning how good the numbers were. So in 2015, as I said, as part of the guidance under the transformation, we came up with 2 forms, 5A and 5B. And 5A was really recognizing some states are much more comfortable with reporting an unduplicated count. And of course, we all want that. It's very hard to achieve. So 5A is really looking at unduplicated to the degree it can be, but it's really your direct and enabling services. And you may be relying on clinic records and these kinds of things. But again, you're reaching a much larger percentage of the maternal and child health population than being reflected in 5A. So 5B was to cross all 3 levels, with the exception of maybe some infrastructure. I mean, really more public health services and systems. But so anyway, and we recognize there may be duplication, but we've got some methodologies that we think could be used to reduce the duplication. I won't say eliminate it, but reduce it. So, we reached out to states, and I can't say enough for the states that have participated. Colorado, Florida, Iowa, Michigan, Rhode Island, Wisconsin, Louisiana has joined our group. We've also had meetings at previous AMCHP meetings and had other states join in. And it's really been a nice collaborative process. I'm looking at Marcus because he's been part of this. And I hope that you all feel it's been worth your time, because we have had several calls and several discussions. In addition, we had AMCHP partners. Some of our academia have been involved. A lot of thought has gone into this. Basically, the work group recommendations, we had 2 goals. One was short-term. What can we do to help you implement the previous guidance? So each year you kept getting what we called clarifying instructions, and it was sort of growing and developing. But the long-term goal was, how do we fix the next guidance? Well, here we are. So enhance the clarifying instructions, really try to be more clear. And what we heard from our work group members, examples, 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 recognizing states do it differently. This is your reporting. You have to be able to justify it, defend it in an audit. We can't tell you where to count things, but we can share where other states are doing it and what their methodologies were for doing that. Also clarify that reporting should include both non-reimbursed and partially reimbursed services. All right, I said 5A, and you're going to hear me say this a couple times. 5A is direct and enabling. 5B is direct, enabling, and public health services and systems. Should the numbers be the same? No. And why not? Unless you're not doing public health services, those numbers should not be the same. And we'll talk later, some of them are. So where's the error? The error is probably in you're counting some population-based public health services and systems in 5A, or you're not counting them in 5B. So that, try to give us some red flags. We've worked some validations into the TVIS to try to help you on this. The other thing is, and this is something that we are doing now in the new TVIS, when you get to Form 5, we're going to provide you with denominators. We've had a few cases, as you'll see in the following slide, where some of you are serving well over 100% of your population. At the same time, we've got some serving 0. So we kind of think maybe the underreporting and the overreporting balance out, but we really do want to fix that. The other thing we are asking you to do with this guidance is put some field notes. We want to know how you came up, what programs, what are you counting? Tell us what this number means. And it's not all for us. It is informing us. It's informing you all as well. So you can go in TVIS. You can see what other states are counting. And again, it's part of that peer learning and sharing to really advance us all. So revise the guidance, improve instructions, include examples in the glossary. I'm going to refer to the glossary again. There's a whole discussion on Form 5A and 5B. Change 5B, and this I'm kind of excited about. We had a lot of discussion in our work group. Form 5B is not going to be a number anymore. It's going to be a percent. What percent of pregnant women are you reaching through your Title V program? And we will give you those denominators, so to help you as well. The other thing that came up, if you look at TVIS, we add up pregnant women, infants, children with special needs, and others. Well, from what we've heard, many states are reporting children that includes children with special needs, and then of that, how many are children with special needs? So it doesn't really need to be summed. So we are moving to having children with special needs. You're still going to have to report on what percent of children with special needs you're reaching, or the numbers that receive a direct or enabling service. But include them in children, and then you're going to report them of that number, how many were children with special needs. So these are the 2016 numbers, and you can see Form A considerably less than Form B. It should be if you really are doing more population-based public health services. But to me, what's really exciting is that column on the far right, and that's Form 5B. Based on what you all have reported, we are reaching in Title V nationally 84% of pregnant women. We are reaching 55% of children in it's not just 1 through 21. We included infants in this. 95% of our infants, which I think is not surprising because of newborn screening, but 53% of children And then of that, 52% of the children with special needs. You can see here the denominator sources. Ashley would kill me if I did not tell you all that. So be sure to look at those denominator sources. Reporting issues. This is what I'm talking about here. You know, we've got quite a range, particularly for children with special needs on Form 5B. We have some at 1,000%. So, you know, we need to work on this. And hopefully the clear instructions, the examples that we've provided in the glossary will help you all. I don't think I need to say anything more. This is why we have pressed this so hard. But Form 5A, okay, so this is your count of individuals. This is your direct enabling. It's in your gap filling services paid by Title V. It's at Form 2, Line 8. That's your federal state partnership dollars. I need to make that point because if you look at Forms 3A and 3B, we break out federal and non-federal. This is not broken out by federal and non-federal. This is your federal state partnership together, your total Title V investment, how many you are serving. We also made some changes when we get to Form 5B. As you remember from the last guidance, we talked about Form 2, Line 9, which was under the administration of the Title V director. We recognized that that was not really accurate. And so that is to the degree a program like home visiting or another program that's not the Title V block grant, but that you're using some of your Title V staff or your Title V materials, or there's some benefit to that program that is really being supported by Title V. So again, for 5A, data sources are typically reimbursement or individual client records, and duplicated to the degree it can be. Insurance. Now, you know, the changes we have made impacted, though, the numbers you're reporting for covered by Title 19, covered by Title 21, private. So they're dropping, and that's another GIPRA measure. So what we're doing in this year's TVIS, we're going to provide you with some insurance estimates, population estimates. You don't have to use them, but if you think you really can't reflect the number of children who received a Title V service, but who are covered by different types of insurance, then feel free to use these population estimates. And then again, we want to know what you're including when, you know, what's the basis for these numbers? This all comes out of the glossary. I'm not going to spend time on it. It's late in the day. You can read the same as I can read, but just be aware there's some pretty good clarification in the glossary, and with examples by category. So, and these again are based on what we've learned from the states in the work group, what we also have learned from reading your application annual reports. So Form 5B, your public health services and systems, and examples could be development of standards and guidelines, program implementation, quality assurance and improvement, workforce development, your population-based disease prevention and health promotion campaigns. Again, here is what comes right out of that glossary. So lots of examples, and it's for every category. Now, the recommended approach, you've got, especially for 5B, that's tough. And there's going to be lots of duplication across these programs. One of the methods we are recommending is to take all your direct enabling services in 5A, list your population-based services, service accounts, and then, you know, look across them. Which one has the largest amount? it's probably a number you can feel sort of comfortable with, that it's probably, don't add them all up, because that's where you're going to get some of that 1,000% of your population. But, you know, if you really look at it where you list them and then try to take the one with the largest reach. And then if you know there's a group that you know for sure isn't included, you can add that to the total. But that seems to be a fairly good way for states to estimate, again, what percent of the population they think they're reaching. Again, use your field notes. This is education for all of us. Reporting errors, and I know from your block grant review, your project officers are sitting there saying, we got this list from Ashley of things that don't make sense, and that's these reporting errors. But again, look at them. If you have a 0 in 5A, and yet this is where our forms talk to one another, Form 3B has Title V dollars for direct and enabling, and you're telling us 0, we don't do any direct services. Well, you said on Form 3B you did. So, you know, these are the kind of things we're going to come back and say, something's not right here. 5A equal 5B, we've talked about that. It shouldn't unless you are not doing any population-based services. Greater than 90% of your population in 5A, again, you're probably bringing in some population-based services. Look at those examples. Less than 10% of your population totals in 5B, you're probably not bringing in those population-based services. The validation errors in TVIS, now that we have the denominators in there, if you have greater than 100% of your population total, you're going to get some kind of an error message, is that correct? To flag it for you. And also, if your children with special needs percent is less than their percent for children in 5B, then you probably haven't really excluded children with special needs are not excluded from population-based services. Any questions about Form 5? And again, I do encourage you to come Monday night. I know it's late, and I know you're tired.
Oh my goodness. Okay. So for states, so there's the CYSHCN subset under child, but that's 1 to 21. How are you wanting us to count our CYSHCN from birth to age 1? Because there's not a subset under infant.
Again, we want you to include them more than likely as infants, and then 1 through 21.
But you don't want to know the difference between all infants with or without special health care needs?
I would love it in a field note. So you can break it out in a field note, but for now, you know, again, these are defined categories and defined by law of infants, that may be something that we need to revisit, but I think for now, that's why, again, anything you can put in a field note helps us.
So I think the challenge we have is we can't break that out in our state. So to be able to accurately reflect 1 through 21, we don't have any way to really do that without including infants in our CYSHCN population. Does that make sense?
Put infants in and put a field note in saying.
Because I think that was our big concern from the EPI standpoint is we don't have a data set that can break that out. And we don't pay for newborn screening with our Title V dollars. So to add them in doesn't really make sense. That's, you know, so. Okay.
Just include them with the children with special needs, but please put a field note that clarifies that. Okay, this is going to be quick and it won't be as tedious. You know, when we first did the guidance 3 years ago, we had Form 11, and we said we're going to pre-populate it. By the way, these are other data that are required by law. And but we just We're not asking you to provide them. We're providing them for you. And it took a couple of years to make them available. They are available, but they're lengthy, so they're not really part of the printed version. But I wanted to bring your attention back to them because there's some really good data in here that you all are going to find very, very helpful. And I believe, Nora, you're going to have to help me on this. There's a link. Is there a link in the hard copy? Of the application and of your printed version, there is a link, but and it's included as a file embedded in the FAD, correct?
That is correct.
Okay. So just to highlight for you some of what is available under other state data, your rates of infant mortality, low birth weight, preterm birth by race, ethnicity. And of course, these are already provided with national outcome measures 4, 5, and 9, but they added preterm birth and updated the race, ethnicity categories. This is one that I've heard states say, we would love to have county level data. You have it to the degree it's available. And of course, it's around infant mortality, low birth weight, and preterm birth. But if that's something that you all think is helpful, look at it. You know, it's infant mortality, 3-year estimates from your VSS mortality file, your low birth weight, preterm birth, 1-year estimates, and it's helpful to examine geographic variation and then to target your program efforts accordingly. And then your MCH workforce. And again, as you think of you know, that introductory section, the state action plan, your needs assessment, this is, this is part of it. Bringing in your workforce, those other areas. I just wanted, the purpose of doing this is just to make sure you're aware of it. And there's Ashley, so if you have questions, please call Ashley. I have one other thing to say, and then we're just going to open it for questions. And I forgot to say it earlier on the narrative state action plan reporting. We have gone back to your annual report narrative will precede your application year narrative. And I know we used to do that. We had to change it last time because it was all so new and we had different measures. But you will be, that flow will be back again where you're talking about your annual report and then you're talking about what you're doing in the coming year. So with that, questions? Everybody is tired, and I think we've reached a limit here, but I want to thank you all. Here's our contact information. I want to thank you. You've been a really terrific audience. You've hung with us all afternoon. I hope this has been helpful. We recognize, though, that this is not a one-time thing, so we're here to help you. Let us know what we can do to provide you with the support you need. Thank you.